Hello, my name is Jasmine Carroll.
And I'm Susie Muhammad, and we're part of the HOSA Club. Today we're going to be discussing substance abuse.
With us today is Miss Melissa Phillips. She is a harm reduction specialist at Lincoln Trail District Health Department. Why don't you tell us a little bit about yourself?
Okay, I have been in that position with the health department for 15 years now. When we talk about harm reduction, some of the programs that includes is tobacco, whether that be tobacco control or policy, syringe exchange programs, and overdose prevention programs through our jails are some of the big ones.
So why did you choose to talk about substance abuse today?
I thought that was very timely with everything you hear in the news. And today we're going to kind of look at it broadly and then bring it down to how does this problem affect teenagers.
What are some common opioids?
I thought we would start with opioids because we hear so much about the opioid epidemic. So opioids are a group of drugs that come from the opium poppy plant. They're a natural derivative from that plant, and they're usually prescribed for pain because they block that pain signal between the body and the brain. The flip side of that is they can be very addictive. So some of the more common ones you guys have probably heard of are Oxycontin, Vicodin, Percocet, morphine, and then the illegal opioid, heroin, and then a synthetic opioid, fentanyl.
What are some signs that a person is addicted?
There are lots of different warning signs. Some of the more common ones to look for is when they get to the point where they cannot control their use. Okay, they are now being controlled by the substance. They're going to have powerful cravings. Physical things like either a sudden weight gain or a weight loss, depending on the substance that they're using. Insomnia. They either can't go to sleep or they can't stay asleep. Secrecy. They don't want you to know where they are, where they've been, where their money's going. A lack of personal hygiene. You know, when that drug is your focus, sometimes that hygiene is the first thing that slips. Isolation, you know, they no longer spending time with their family, their friends. Maybe they're not doing things that they used to enjoy, you know, sports or hobbies, things like that. And then a final one is risky behaviors. Maybe they're stealing to get the money to buy their drugs. Maybe it's risky sex or having multiple partners. Maybe it's violence because they're high and they don't even realize what they're doing.
Wow. What does the drug problem look like locally?
I brought a few statistics so you can kind of see a local perspective. In Hardin County in 2017, we had a little over 400 people who went to the ER for a drug-related visit. In 2018, in the Lincoln Trail ad, which is 8 counties, and Hardin County is right in the center of that, there were about 1,900 arrests for meth and about 1,500 arrests for opiates, you know, just in our little local region here. And then to bring it back home again, talking about overdose deaths in Hardin County, in 2017, we had 18 overdose deaths, and in 2018, that actually went up to 21. So our overdose rates were climbing. The good news is in 2019, they actually went down just a little bit.
Wow. So what are some consequences of this drug use?
Some of the things you might not think about when we talk about the drug problem are kind of what I call unintended consequences. And one of the big ones is disease transmission. The top two are HIV and hepatitis C. In 2017, we had 154 people in Hardin County who were living with HIV. And I don't think a lot of people realize that. And we had almost 180 people who presented to the ER with Hep C. And we know the number one risk factor is IV drug use, which means they inject their drugs for both of those diseases. Another one you hear a lot about is children being removed from the home because mom or dad or both have been incarcerated because of drug use, and that has since overburdened our foster care system. And we've got relatives raising, children, grandparents raising grandchildren. And kind of along that same vein, babies being born addicted to substances, and we call that neonatal abstinence syndrome. So we've had to learn how to basically detox babies from birth.
How do you define prescription drug use?
It actually has two prongs to it. Prescription drug abuse is when you take a medication that's not prescribed to you. And it's also when you use a medication in a way that wasn't intended by the physician. Usually that means taking too much, more than the prescribed dose. You've got to realize, too, that over-the-counter drugs can be abused. Again, using it in a way that it was not intended. So when a doctor prescribes a medication, they take a lot of things into account. Your age, your weight, any other medications you're taking so you don't have a reaction, and also any allergies you may have so you don't have a reaction. And you've got to consider, too, that when you mix either over-the-counter drugs or prescription drugs with alcohol, that's very dangerous.
So what does this mean for teens?
I brought a little bit of data for teens so that you guys can take this back to your peers. When you guys are in high school, even in middle school, you do a survey called the KIP survey, and they ask a lot of questions about drugs and alcohol. So that's where we get a lot of our teen data. And we know that the most commonly abused drugs by teens is actually tobacco and alcohol. But when you dig a little deeper, we also know teens are abusing cold medications, inhalants, if you've ever heard the term huffing, and stimulants like ADHD medications. So those are kind of the top medications abused by teens. But when you look at illicit drugs, the illegal drugs, the number one drug abused by teens is actually marijuana. And through those surveys that I mentioned, almost 36% of 12th graders report using marijuana, and then almost 7% of them say they use it every single day. So that's a really high number for an illegal substance.
Yeah. What are some programs that help combat the drug problem?
Well, this is what I do, and we have learned over the years that there is no magic bullet. There is no one answer. We need prevention at the table. We need law enforcement at the table, and we also need treatment. They all have to be working together. We can't treat our way out of the drug problem. We can't arrest our way out of the drug problem. We all have to work together. So some of the programs that we know that work, that are evidence-based, are the prescription drug drop boxes and the take-back programs. That way, if you have medications in your home you're no longer using, you can take them to these drop boxes and they're disposed of properly. Syringe service programs. We actually have 2 in the Lincoln Trail District right now. One is in Marion County and one is in Nelson County. And we're in talks to have a 3rd one in our district too. So that means an IV drug user can bring their used syringes in, dispose of them properly, and be given clean injection supplies. That way we're not spreading Hep C, we're not spreading HIV, like those statistics we talked about earlier. Education programs at school. Did you guys go through the DARE program?
Yes, we did.
Okay,
Yeah.
so that's one that we know works. And one of the newer ones, it's been in existence about 2 years now, it's called Too Good for Drugs. So we're slowly getting that into our school systems. What's really awesome about it is it can go all the way from kindergarten all the way to high school. So you wouldn't just get that 1 year of DARE, you'd get that drug education every single year. Overdose prevention programs, especially for folks coming out of the jail, because we know that population is very at risk for overdosing. So we teach them what the signs of a potential overdose could be. Ideally, we put Narcan into their hands and we teach them how to use Narcan, because you guys know if it's an opioid, Narcan can reverse that overdose. So it's a really neat medication. And then another one that's slowly catching on is called medication-assisted treatment, or MAT. And that's using drugs like methadone or Suboxone to help a drug user wean themselves off that drug.
So how could someone get involved locally?
At a school-based level, look at what clubs you have. SAD, I know HOSA, you guys are looking at substance abuse. So see what clubs are at your school level. We have a newly formed substance abuse coalition in Hardin County. It's called COPE, which stands for Community-Oriented Prevention and Education. And that's what we're trying to do, is bring those three sectors together, the prevention, the law enforcement, and the treatment, and see, how can we best attack this problem, at least at a local level.
So what is the gateway drug that people usually start with?
When kids are going to experiment, and it's usually around 12 or 13 years old, they're usually going to start with a tobacco product. If they don't have the ill effects with tobacco, generally they'll move on to alcohol. Again, they don't experience the bad stuff with alcohol, a lot of them will move on to marijuana. Usually, if somebody is going to end up with an illicit drug problem, it's because they used marijuana. We hear that story after story after story. For some folks, they move on from marijuana to pills. If they're in the home, they're readily available. They might experiment with pills, specifically pain pills. And for some folks, when they can't get those pain pills any longer, heroin or meth becomes a much cheaper option, and they turn to street drugs. So it's kind of a progression. That's kind of why we call it that gateway.
So earlier, you were talking about hygiene problems with addicts. Mm-hmm. So what specifically do you see about their hygiene?
Well, like I said, hygiene is not a priority at this point. So they're probably not going to be washing their clothes. And you guys know if you re-wear clothes multiple times, you start to smell that body odor. Not bathing regularly, so that's going to have the smell. It's going to affect your skin. You're not brushing your teeth, so that's going to affect your teeth. When you don't wash or brush your hair, you're just literally going to see effects head to toe when you're not taking care of your body. Part of that's not eating properly. It's not staying hydrated. So it really does take an effect, total body, from your hair, your skin, and to that weight loss we talked about, because it's just not your focus anymore. Your focus is, I have to have this drug.
Well, now we're going to move on to teenagers and the effects of drugs for them. So is there any effects to teenagers smoking marijuana?
There is a big misconception that marijuana is not addictive. Okay. We do have research that says that yes, it is addictive. Is it addictive as nicotine? No. But you can get hooked on marijuana to the point where your body says you have to have it. It does interfere with your brain development. Okay? It's going to interfere with your coordination. So in states where they have legalized marijuana in different aspects, you see a lot more DUI arrests because they're trying to operate motor vehicles under the influence of the marijuana. So I know there's this huge misconception that it's somehow safer, but there is still a lot of issues with the marijuana. And it is still an illegal substance in Kentucky, so people need to take that into consideration.
So how easy is it for a teenager to get marijuana or any type of drug or alcohol?
For a teenager, I would say it comes down to access in your home and access in your peer group, because you're not in a position to purchase usually. So is it in my home and I can get it without my parents knowing or my older siblings, or in some households, the parents don't see it as a bad thing, and they willingly provide to their teenagers, which is illegal. And then your peer group. You know, if you're in a peer group that has access, especially if you hang out with older kids, that's usually that step in the door for our high schoolers.
Is there an increase on marijuana use for teenagers?
Well, we looked at that, and you know, we said about 36% of 12th graders said they have used it, and our daily use numbers are slowly creeping up. So that tells me that there is an access problem, that kids are having greater access to marijuana.
So do teenagers abuse drugs more than they vape?
The answer to that is no. The vaping numbers with teenagers are huge right now. You remember those surveys we talked about? At this point, about a quarter of our high schoolers report that they're vaping. For the first time in our history, we have more kids vaping than using any other tobacco product. So our smoking rates are really small with teenagers, which is awesome. But our e-cigarette numbers, those vaping numbers, are just continuing to climb.
Which would you say is more harmful, drugs, opioids, or vaping?
Depending on which drug you're talking about, you know, depends on how they affect the body. When we're talking about the vapes, we're talking more about pulmonary, about more lung damage. Whereas you look at, say, marijuana, we're looking at more, it does some lung damage, because anything you enter into the lungs that's a foreign body that you smoke is going to do lung damage. But we're looking more brain damage with the marijuana. And then opioids too, you know, you're rewiring your brain to tell it that it needs that opioid. So different types of damage, but I won't say one is worse than the other. They're just different.
So when you do drugs such as marijuana or vape, does it leave a smell on your clothes?
It will. Let's just talk about the vapes first. You know the big cloud that they produce? Well, it's literally a cloud of chemicals. So those chemicals have to settle somewhere, right? They don't just stay in the air forever. So they settle on your soft surfaces, your clothes, your couch, the upholstery of your car. So those chemicals are now on your surfaces. And that's really dangerous for people like babies, toddlers, or even your pets that are always in contact with those surfaces. So we call that third-hand aerosol. The same with the marijuana. The chemicals in that smoke are going to settle on your surfaces. So yeah, it's going to be in your hair, it's going to be in your clothes. So again, you put babies or pets or something against that surface, they're going to inhale those chemicals, third hand we call it.
Okay.
So what are the harmful effects of vape, and also why was the age changed from 18 to 21?
Okay, so let's kind of dissect that. We've had two law changes with the vapes recently. The first one was federal, and it changed the age of purchase and use from 18 to 21. So that means you cannot use or buy any tobacco product, vapes included, if you're under the age of 21. Now, Kentucky's law is still set at 18. So it's at the legislature right now in the process of being updated. So it'll be 21 at the state level and the federal level. Something else they did at the federal level was a partial flavor ban. So you can only, in the pod-based vapes like the Juul, you can only get those now in tobacco or menthol flavors. There was a loophole, however, in it that it did not include the disposable vapes, the ones where once you use it all you throw it away, or the tanks where you put your own liquid into it. So, like I said, it's a partial flavor ban. So what we're seeing is kids who are very smart see the loophole and they're starting to go to the disposable ones and going away from the Juul and those similar products. So tell me again the other half of your question. The physical harms?
Yes, ma'am.
Like I said, a lot of them are pulmonary. We've seen 3 different kinds of lung damage. And the most recent one they nicknamed EVALI, and people were dying from it. The lung damage was so severe. It was like a chemical burn inside your lungs. Again, any tobacco product, because of the nicotine, it rewires that brain to tell your body that I have to have it now. So it's a very powerful addiction. They rank nicotine addiction up there with heroin addiction. So when people then try to get off of nicotine, it's really tough. Some of the flavors with the vapes are more dangerous than others. What you got to realize is there's no quality control. There's no agency that makes them put their ingredients on a label. If you've ever looked at one, there is no ingredient label. So you don't really know what's in these flavors. But we know some of the chemicals that make the flavors are more dangerous than others. They actually damage blood cells in your lungs. So, like I said, anything you put into the lungs that is not oxygen, you're really risking your health.
In your opinion, do you think that the law change actually benefited anybody?
I think there was a lot of pushback from the vaping industry, which is owned by the cigarette companies. When the vapes got so popular, there was a whole lot of little mom and pop shops. But then the big tobacco companies saw, hey, these things are selling like hotcakes, and they went in and bought them up. So now you have the big vape companies, and a lot of the little mom and pop ones have gone away because they couldn't compete. So yes, the vaping industry threw a lot of money at the government and say, hey, you're affecting our bottom line here. And I think that's why we ended up with that partial flavor ban instead of one that took away all those flavors that appeal to kids.
So do teenagers have any programs like DARE or anything later on in their teenagehood?
So on into college and things?
Yes.
I don't have a good answer for that because I don't deal with the universities a whole lot. I would imagine there are, though. And that's a good thing for, a lot of this stuff started grassroots. It started because one person had an idea and said, hey, what are we going to do about this? So if that's something you're passionate about, find out what's out there. And if there's nothing out there, be the one to start it. Because, the smoking ordinances that we have now, they started grassroots. Some of the syringe exchange programs that we have, again, started grassroots. One person said, hey, why don't we have this? So don't be afraid to be that person that says, why doesn't this exist and how do I make it happen?
Personally, do you think that there will ever be a program for teenagers in vaping? UK has started one that is, now that you said that, it sparked something. That is for college-age kids, and they are in the piloting stage right now, but they are coming out to like middle schools and high schools with their program. So that would be a good one to look at to see what they're doing, because I know they're trying to get it out of that model stage and into regular practice. And I cannot think of the name of it right now, but UK has one. That's the only one I know in our area that specifically targets college-age kids and vaping. What tips would you give to teens for them to avoid vaping or to stop vaping?
There are actually a couple of tools out there specifically for youth who are trying to stop vaping. They're usually internet-based, some are text-based. So those are really good for kids who don't think they would call like a quit line. But it's a little bit different for kids because we know that tobacco, like I said, literally rewires that developing brain, and we know that gives them more likelihood to be addicted to other substances later in life. So that when we talked about those gateway drugs, that's why tobacco is so worrisome, because we know if we've already been primed for addiction, if I try those other substances, I'm more likely to be addicted to them later in life. So I know people don't worry about tobacco as much, I don't think, anymore,
but it does prime youth for further addiction. So us in our field really do still put a lot of time and effort into tobacco efforts with kids.
Why would you say teens are more addicted than adults?
Like I said, that developing brain can be primed for addiction, whereas an adult who's already addicted is just worried about maintaining. That's why with our adults, if they don't want to consider medication to stop using a tobacco product, we talk about tapering. That way you don't totally take away that nicotine source all at once. You take it away a little bit at a time. That's basically how nicotine replacement works, like the gum and the patches. They gradually step them off that nicotine because it's so much easier on the body to do it that way than to just take it away all at once. So, if a teen was at the point where they were addicted to nicotine, we would do the same thing, either teach them how to taper off their use, or they would work with a doctor to use that nicotine replacement.
How successful are nicotine patches and gum?
I think a lot of people don't have success with those products because they don't understand how to use them properly. So they do need to talk to a professional about how to use them. A lot of them want to use the gum like chewing gum, and that's not how it works. So to have the most success, honestly, they would use that nicotine replacement product in combination with some counseling. When you have both those pieces, you have a much more greater success rate.
How does vape affect the growth of teenagers compared to an adult who vapes?
Well, we know an adult has stopped developing, but that youth still has that developing brain. So the nicotine, no matter where it comes from, interferes with that brain development. And again, I can't say it enough, it primes that brain for future addictions. So that's, greatly worrisome. But nicotine from any source is going to stunt your growth. You're not going to reach your full potential. Physically, your growth, the development of your brain, the development of your lungs, heart development, all of your vital organs are affected by nicotine. So what's especially concerning about the vapes is some of those chemicals they've added, number one, to create the cloud, and number two, to create the flavors, are so damaging to that lung tissue. So if you've done that damage at a really young age, that's really concerning.
Are there any programs locally for people with addictions?
I'm going to give you a couple of resources. If you're struggling with a tobacco addiction, Kentucky has a quit line. And then if you're struggling with any other type of addiction, there is a really good resource called Find Help Now KY. And actually it will help you find an open treatment bed. You put in all of your circumstances, who you are, where you live, if you have insurance, and it will find the closest bed to you. So those are a couple of really good generalized resources. And then if you just have general questions, looking for a resource that we can plug you into from the health department, our main number at our district office is 270-769-1601, and hopefully we can connect you to the right resource that you need.
Ms. Phillips is a harm reduction specialist at Lincoln Trail District Health Department. Thank you so much for the wonderful insight.
Thank you all for joining us for this edition of EC3 HOSA Medical Moments.